Welcome to 1332 Mental and Behavioral Health, Classroom and Clinical Expectations. Student behaviors, expectations. One of the big things is I would want you to be prompt to class. Since we're in this virtual world, that means signing in 10 minutes early. Doesn't mean that you need to be chit-chatting and chatting, but you electronically need to be signed in and let into the classroom so that you're ready to start promptly at the start of the hour. Be prepared and have your materials with you and know your due dates. Be polite and positive participant. Speak in a normal tone of voice and listen and be attentive. And be productive. Turn your work in on time and always do your best. Be a problem solver. Correct the problems quickly, peacefully before they escalate. Don't sit, don't assume, don't stew. Something that can be a simple misunderstanding, if you had said something, it could have been addressed and it would have made and brought peace to you a whole lot sooner than not saying anything at all. We want you to talk. We want to know what's going on. So please say something. Show respect. The first place this has to start is with yourself. You've got to value yourself. In doing that, you've got to be honest with yourself and be ethical and practice strong moral values. And in so doing this will share and be shared with others around you. Treat your instructors, your fellow students with politeness and respect. Honor the ideas and opinions of others. Offer to help. It is amazing how much more you learn through helping others. It is expected that you keep your camera on at all times. This will help you stay attentive to the task at hand and not drift off. And that leads right into staying focused at the task at hand and not on other things going on around you. You need to set up your home environment like it is a classroom, like you are on campus, so that you are able to stay focused. You've got to turn that TV off, that radio off. Put your phone aside and stop those distractions. You want to learn, you want to absorb information, and you would think you would be able to multitask and learn and be able to actively listen. Well, guess what? One of the things you're going to learn in mental health is your active listening skills are not as good as you think they are. And you're going to learn about that in this class, but you're also going to learn on how to improve them. These are some givens, but you need to do them. You need to follow the dress code. You need to be wearing your uniform. You don't have your uniform, you aren't going to be in class, you're not going to be in clinical. You need to have it. You can come back in, but you need to do that during a break because we're not going to interrupt class to get you back in. You need to wear minimal jewelry. Stud earrings, wedding bands, watches, except for no smart watches during our exams. All the other piercings you've got need to be out of sight. Your hair needs to be neat and pulled up. In mental health, we don't wear ponytails. That is because they can be very dangerous. When a patient grabs them, they've got full control of your head. So I'm just mentioning that. I'm not going to penalize anybody for having a ponytail. I just want to have you guys be aware that that can be a big, huge issue. Nails, we shouldn't be wearing any polish. They should be 1/4 of an inch in length. And you should have proper hygiene. Be responsible for your coursework. Bring your notebook, your textbooks, your binders, your folders, appropriate writing tools. Know your due dates. Submit all your coursework on time. In your class tile under modules, under the course introductions, right below your syllabus, is your syllabus attachment. That attachment is where all your course due dates, exam dates, are all laid out for you. Homework. All these things are laid out so you know when they are due. Your reading assignments. What's not in there is exactly what chapters you're going to be quizzed or examined on. I announced that in the class the week prior to those exams. Now, note that any of the chapters that we are to have on that reading are open for those quiz and exams, so you need to learn them. However, I will specify what ones for certain we will be covering on that quiz or that exam. So you need to have your writing materials with you. When you are confused about something, please make sure you go to the sources. That means your syllabus attachment, or you contact your instructor to confirm what you need to know on your assignments. It's great to ask your peers, however, make sure you go to the source, because after the fact you cannot fix the problem. You need to be proactive. Absences. Make sure you follow policy, which means you need to 60 minutes prior to the due time contact your instructor to let them know that you're going to be absent or late. Otherwise, that is a no-show, no-call. Now, late is very questionable because late is not an acceptable thing. And we'll discuss that in a minute. There are exceptions, and we'll discuss that in a moment. It is your responsibility to get your work that you missed when you return to class. It is not your instructor's responsibility to reach out and fix those things for you. You are responsible to reach out to your classmates to figure out what you missed, to get notes, those type of things. Review your absence and tardy policy and the impact, and we'll discuss those in detail in a minute. Clinical. You must arrive on time and stay the whole 9 hours. Per the policy, if you're late, you are not allowed to stay. Or if you decide you have an appointment that takes priority of being and staying in your clinical day, you cannot stay in your clinical and come back. We understand life does happen, but school has to move forward with the other students. And sometimes you just can't be part of that moving forward. It's part of life. We understand that. But per regulatory boards, you have so many clinical hours that you have to complete. And especially in term 5, you know how tight this schedule is. You don't have a lot of free time to plug in hours. You'll get directed once we have a discussion to talk with leadership, and they will make a determination whether you're going to be able to make up those missed hours or not. That is something that is above and beyond our classroom decision. That is going to get made. But there are exceptions, and that is when there is really an emergency that takes place. That's life and death. Somebody is injured. That is an emergency room trip. Those type of things. Those are things that are beyond our control, your control, life's control. And the school will do everything in their possible to help you with getting those hours made up. During clinical, there are going to be many concepts that you need to cover, and your time is very valuable and it cannot be wasted. You're going to be asked, especially in this clinical, to think on your feet and do it rapidly and to move very quickly from one task to the next task to the next task. And you're going to feel the pressure, because that's what happens at clinical. And so we've got 9 hours to get those assignments completed in. And yes, you're going to feel the pressure, but you're also going to learn quite a bit. To promote long life learning, and get these traits. You do this by showing curiosity about human nature and how the world works. You seek and value diversity. You persist and seek out new solutions. You seek out learning opportunities. You engage with people. You use your unique talents and intellect to promote positive change. You learn by applying technology and tools to problem solve. And you continue educational courses. This is how you promote lifelong learning. So in our course, this is our grading course. This has not changed for our overall grading. And we know that anybody that hits at about an 80% is at risk for not succeeding. So because you need to be at an 80% or higher. Our HESI, our final HESI, is 40% of your grade. So let me flip this here. So when we're looking at our exams, they're 15% of your grade. Quizzes are 10. Assignments are 10. Our assignments help prepare you for your exams, for your final HESI. Your proctored midterm HESI, practice HESI, is 5%. Your final proctored HESI is 40%. Your remediation is 5%. Your clinical tasks that we do, that you have 45 hours of clinical, that's all you have. You have 5 9-hour days, is 15%, equaling 100%. Regarding homework, EAQs, majority of them are set to proficient level, with a couple at intermediate level. So with this in mind, what we're going to do this term is, ideally, you really want to get to a proficient level to get that 100%. The reason behind this is it's going to expose you to more of the concept and more difficult level questions. Now, this means you need to open up your book. You need to have read your chapter and have your book open while you're asking and answering these questions. When you get a more difficult level question and you do not answer the question correctly, you are going to have more questions come at you. So on average, you may get 60 questions posed at you if you're answering them all correctly. But if you get a question and you're answering the simple ones easy, you'll get less questions. But if you get difficult level questions and you miss one of them, you potentially are going to have more questions coming at you. And that is how come you get more questions coming. So I'm hoping that makes a little bit of sense as to why you may have more questions coming at you. You want the difficult level questions because this is going to prepare you for your board exams. So we will grade based on 100% for hitting proficient level, 80% for intermediate level, and 70% for novice level. But if you are not hitting those levels, then you're going to have more difficult components. If you have a level that's set at intermittent level, then your novice level will be at 80%, the other two will be at 100%. So the more questions you do, the higher level you can go. So even if you hit proficiency level, you can go on and do more questions. Case studies, there'll be practice quizzes and exams that are in your HESI cohort. Those will not be rounded up. They will be the exact score that you get that is entered into your grade, into your grade book. So my pledge to you is I'm going to trust you till you give me a reason not to. So with that in mind, all your exams are going to be proctored. You will be broken up into groups and you will have an instructor proctoring you. So this will mean you will sign in using your cell phone, and your cell phone will be set up behind you over your right shoulder. That needs to be able to see your monitor, your keyboard, and you during your examinations. Our examinations are at week 2, week 3, and I want to tell you week 5, but it may be week 4. I believe it's week 4. I don't have my schedule right in front of me at this moment, so you need to be prepared for that. Our HESI exam, I believe, will be on campus, but if it is not, then it will be proctored through virtual again, and it will be set up the same way. Your environment will be screened. All of your books, etc., will need to not be in the room. You will need to have a dry erase board and marker with a rag to wipe and a simple calculator in case you have to calculate a formula of some sort for math purposes. With that in mind, I'm going to respect you and the work with you to solve any kind of problems that come up. I will promptly correct and offer feedback to your work. I will work with you to meet your learning goals. I will hold you accountable. And I will offer you extra help and alternative ideas should you require them. Final thoughts: when I discuss with you any concerns about your work, make a change. When I offer to help you, use it. Ask questions if you don't understand. My job as your instructor is to help answer your questions effectively and in a respectful way. These are your course objectives. There are 6 of them. When you look at your big syllabus, you have your content is broken out and over each of the concepts you need to learn. So if you want to map to the things you need to learn, that is, I should say, your map. That is your study guide. Use that. My office hours, Monday, Tuesdays, and Wednesdays from 11 to 1 o'clock and from 5 o'clock to 7 o'clock. I am teaching the evening and day courses for 1332. So I do have all students for both groups. And I open this up for both classes during this time. On Wednesdays from 6 o'clock to 7 o'clock, I will meet and open a tutor session to go over concepts, review ideas, review thoughts. Bring what you need to go over. It is not my responsibility to organize what you need to learn. It's yours to bring in what you need to learn. So bring what you need. I will help walk you through those things. Okay? Individual tutoring can be requested at any time. Individual meet and go over items. Contact me. We will set that up. We can use the office hours to do those things for. We will set that up on phone. We can do that over Teams. I prefer it over Teams so we can meet and see each other and review and share things back and forth to see what we've got going on. If during any time you have a grade in the class that falls below 80%, you are required to meet with me. This is part of your new responsibilities on your syllabus. The reason behind this is so we can identify where your strengths and weaknesses are, how you're tackling your studying, making sure you're actually established enough study time, and develop a plan to attack where those areas of weaknesses are so that you can improve and ensure that you're able to pass the course. In addition, you may be required to do additional tutoring sessions. That's going to be on an individual basis. Review and receipt. Your syllabus. So your first thing I want you to make sure you have done is that you have gone to your course tile under modules and gone to the course introduction section and found your syllabus and you have read it, you scroll down and also have read your syllabus attachment and go down to the next one, the Nursing 1332 syllabus signature page dated 7/27/2020, and you download that page, that signature page alone, and you have printed your name on it and you have signed it, and that you upload it into your assignment. That is due 2 hours post our class today on the 30th of July. That is one assignment right there, one whole point towards your 10%, okay, of your grade. The next thing that'll be due on next week on Saturday the 8th is your remediation must be completed. That is where all your essential packets are completed, and your post grade on post-test grade is at 78% on each of your essential packets. Now, with that being said, it's not just that post packet being 78%. You must have done the readings of each of those sections or the assignments that are in there. So you do your pre-test, then you go and do your essential packet remediation, and then you go do your post-test. A lot of people have questions all the time. Well, those questions, the readings aren't anything about those questions that I'm being asked. Those readings are about your test and the questions you missed within your test and the concepts you were missing and not understanding. And the questions that are being posed to you are part of the concepts that you were missing. So it's a bigger, broader picture of what you weren't understanding during that test. Okay? So it's looking at your accrual time as well as that 78% on each essential packet. And that is what's going to get you your 100% of your remediation grade. Make sure you have looked through all your Canvas products. Remember, you have a HESI tile, and it's not until you get into week 4 that your first assignment is due on your HESI tile. But we start using your HESI tile during your clinical. Then the last thing you do, that is due right after class, and it's still in your course introductions module section there, is your community support group project paper. It's called Community Program Report Instructions. I need you to go to that after reading that, go to that last page, and I need you to sign and date that you have received and reviewed that section. So what that is all about is that you are going to actually participate and attend support groups, 2 of them that are being held in the community. Now, physically attending right now is not recommended because of the fact we still are dealing with COVID-19, but you can attend virtually. Go and attend something you're interested in. I do recommend, because of the fact of all the board exam, all the HESI testing, to make one of those meetings an AA meeting, because of the fact that testing seems to help. This helps a lot of people understand what's taking place in an AA meeting. You get a better picture, which will help you with your test results. But please make sure to pick something you're interested in, to get a concept of what a support group is and the difference between that and a therapy session and a therapy group, because they're 2 different things.